You're listening to Emmy Award-winning host Jordan J. Adams.
Well, it's Science Saturday here in the United Fight Alliance studios, and for all those who have said, just give us nutrition science, we want science, well, that's exactly what you're getting today. Dr. Peter Langsjoen is considered the world's foremost expert in the use of CoEnzyme Q10 to treat cardiac disease. Dr. Langsjoen received his Bachelor of Science in Chemistry with honors from the University of Texas at Austin. He received his medical degree from the University of Texas Health Science Center, did his internal medicine residency at the University of North Dakota, and his cardiology fellowship at Scott and White Memorial Hospital in Temple, Texas. He conducts his research and clinical practice in Tyler, Texas. It's time to make our fighting weight with Dr. Peter Langsjoen. Thanks for being with us today, Doctor.
Yeah, my pleasure. My pleasure.
Doctor, you are widely considered one of the world's, if not the world's, foremost expert in the use of coenzyme Q10 for really all causes, but in particular to treat cardiac disease. Can you first give us a quick snapshot of what coenzyme Q10 is? Is it a vitamin, an herb, a mineral? I mean, what is it?
Yeah, that's very important. It has a confusing name, and many times people refer to coenzyme Q10 as an enzyme. And it's important to realize that coenzymes are very small molecules that are absolutely essential for the function of a large enzyme system. Most vitamins are coenzymes or cofactors for different enzymes in our body. Coenzyme Q, and I usually refer to it just as Q, is the coenzyme for three huge enzyme systems that make about 95% of all cell energy. So it's an absolutely essential cofactor in energy production in all our cells. So if you wanted to think of CoQ10 and describe its functions maybe in just two words, one would be energy, and the other is defense. It's a remarkable free radical scavenger. And it's located primarily in the powerhouses of our cells, in the mitochondria. That's where we burn food with oxygen and we create carbon dioxide, water, usable cell energy, that's the ATP, but we also create free radicals. And there's a beautiful cycle. Coenzyme Q interacts very rapidly with free radicals, thereby protecting the rest of the mitochondria and the DNA in the mitochondria. And when it does that, it goes back to its oxidized state, ubiquinol, and in that state it acts as a coenzyme for the production of energy. And so it's a cycle. It's a beautiful cycle of an antioxidant and a coenzyme. And so energy and defense pretty much sum up the biochemistry or the function of Q. And another important aspect of it, it's not a vitamin because we can make it. We make Q very well when we're young, and interestingly, and I think particularly for your audience, Q, which remember is essential for energy, it peaks at exactly the same time you have your peak Olympic athletic performance, late teens up to maybe mid-20s. And I'm sure we've all heard the term with these elite athletes that once they get up into their mid-30s, they're over the hill. Well, their Q levels are already starting to drop because their ability to make it starts to decline after, say, mid-20s. And the exception to this drop in Q as we age is those few people who still eat a fair amount of foods that are very high in Q. And these are mostly organs that work all the time. So heart muscle has the highest concentration of Q. So if you added some chicken hearts to your stew or your chili, you get a lot of Q. If you fry up some liver once a week, you know, organs that work 24/7 use a lot of energy, so they're the highest sources of Q. And if you don't eat much in the way of hearts and livers and kidneys, your Q levels will drift down as you age. And with that, there's a general decline in your physical abilities.
Well, you have said in the past this is one of the, if not the most important substances ever discovered. You said, if this quote is off, the clinical experience with coenzyme Q10 in heart failure is nothing short of dramatic, and it's reasonable to believe that the entire field of medicine should be reevaluated in light of this growing knowledge. Is that accurate? Is that important of a substance?
Yes, it is that accurate, and it is the first time in medicine that we've been able to fundamentally and dramatically, I might add, improve all cell function. If you think of medicine, we've become a profession that looks at just the eyes or the ears or the teeth or the heart or you name it, you know, just some specific organ or part of your body. CoQ10 influences everything. Your skin, your gums, your heart, your skeletal muscles, your nerves, your retina. And so to be able to measure a compound this important and to be able to administer it and start to affect in a favorable way the health of the entire body, yeah, that's a powerful thing, and it changes the whole way of looking at it.
So you listed a couple of the parts of the human anatomy that it helps, and when I was looking through the list, when I was doing my research, I was absolutely amazed. Dental health, macular degeneration, sperm count, tissue, anything that has to do with, it seems, the aging process is affected positively. Anti-inflammatory, and we all know how important keeping the inflammation in the body is, keeping it low. Pretty much everything that seems to be associated with aging seems to be affected positively by coenzyme Q10.
Yeah, that's correct. And one of the very important things to realize about Q, and also interpreting the literature of Q, which goes back to 1957, so there's thousands of papers, many thousands, is it took quite some time to realize what a therapeutic level of Q was. There's a threshold in your blood that you have to get Q above before you start seeing tissue effects. For instance, heart muscle. We can measure heart muscle non-invasively and fairly accurately. And we know that if you give, let's say, a small amount of CoQ10 and the blood level is, from what we've learned over the years, subtherapeutic, you'll have little or no effect. And the same thing is true in some of the studies that have looked at elite athletes. These are people in perfect health. Can you improve their athletic performance by giving them Q? Well, the answer to that is no, you can't if you give them a meaningless amount of Q. It doesn't do anything. But if you give them a good amount of Q and you attain high enough blood levels, you get very significant changes. It would be the difference between a gold medal and a silver medal for sure.
Wow. Wow. Let's talk about some of the different areas of the body that it protects, because I'm sure we have a bunch of people who are listening who have different concerns. We talked a little bit about heart health, and I know you've done some studies. Let's stay on the heart just for a second. I know you've done some studies to try to find out if it can help someone, let's say, who is quite a bit down the road in terms of their heart disease, significant blockage in the arteries and maybe even congestive heart failure. Was it? Did it prove to be effective in patients who are far down the road, or do you have to get to it pretty early for it to be effective?
It's a great question. And it varies a little bit. It is, on average, better if you have the opportunity to treat someone with heart failure relatively early in the course of their disease. So if we see someone with congestive heart failure that was diagnosed within the last year, there's a higher probability that we can turn that completely around to normal heart function. But there's other variables to it. Hearts, when they fail, gradually stretch out and dilate, and the walls become thin, and they actually gradually replace viable heart muscle with scar tissue. And that shows on echocardiograms as being, we call it echo-dense. It's like dense, thin heart muscle. It's hard to improve that very much. And that process usually takes time to develop. So in general, earlier is better because you're intervening in a stage when the heart is weak, but it's not, you haven't permanently lost a lot of muscle. It's not fibrotic is the term we use. So yeah, early is definitely better. There's some exceptions. Sometimes you can see a new patient who's been in and out of heart failure for 5 years and still do a great deal of good with it. So we always try it, and because you have nothing to lose, you have no side effects, and we use CoQ10 in addition to whatever conventional medicines are appropriate.
So it seems the takeaway there is that it's a little bit easier to prevent the damage in the first place, or slow down the damage in the first place, than it is to revive the heart muscle once it has been damaged.
Yeah, it is. Yeah, definitely.
Let's talk about some of the other areas, because it's so remarkable in all of the different functions it has. If God forbid, someone has cancer and they're in a chemotherapy protocol, this has actually been demonstrated, and I believe peer-reviewed, double-blind, been demonstrated to help greatly with the recovery and protecting, because chemo also takes out the bad cells. So I mean, takes out the good cells as well as the bad cells. Does this help prevent the good cells from being taken out by chemo?
Yeah, this is a little controversial in cancer centers. Some of them, like MD Anderson in Houston, for instance, forbid their patients to even take vitamin C. They want them on no vitamins. Their rationale being, you may lessen the killing effect of the chemotherapy on the cancer cells.
Okay, I get it.
That's possible, but you're also protecting all your own healthy cells. So the one thing that we can say for sure is that when you use chemotherapy that is very cardiotoxic, like adriamycin, it's famous for causing heart failure, if you give these patients CoQ10 while giving them this toxic type of chemotherapy, you definitely protect the heart. Now, and the few studies that have been done on this show that you don't lessen its effectiveness on the cancer. But most cancer centers shy away from Q. They don't tend to understand it, and there's some exceptions. There's one cancer center, it's either in Oklahoma or Kansas, I'm blanking on where right now, but they have the belief that this is helpful, that people recover better from their chemo, they have less complications, so they look at it as a net plus. But then
forgive me, it seems inexcusable to me that a hospital would not know about this, or would just not be educated about this, given the amount of literature that's been done on this substance and the favorables that it has in so many different categories. I can't see not implementing it at least as part of the protocol.
Or at least studying it. You know, they have the assets to analyze this better than anybody else. They have a ton of funding. And I think it's because it's a nutrient. There's always a bias about nutrients versus pharmaceuticals. And you know how that goes.
We come back to that age-old thing, man. It comes back to market share, and it comes back to who's making the money, and people zealously and jealously guarding their turf instead of what should be the dominant factor is getting people well. You know, what was it? What did they call it in Star Trek? There was the number one law, like you don't fiddle in other cultures, and there was a rule for it. I can't remember what they called it. Any Trekkies out there, let us know what that was called. I can't remember, but it was the primary directive. The primary directive. The primary directive should be getting people well, not guarding your money and guarding your market share.
Yeah, true enough.
It's another subject, Doctor, and I want to ask you to go down that road. We'll talk science, all science here. Another remarkable property of CoEnzyme Q10, fighting melanoma, fighting diabetes, endothelial dysfunction. I mean, remarkable.
Yeah, it is. And again, it goes back to the fact that its effects are not specific for one organ. You're influencing your immune system, which influences almost everything. So people with a good Q level tend to be remarkably healthy. It's wonderful. My clinic has some of the healthiest people around. You know, they're all on CoQ10, and it's a lot of fun to follow them over the years.
You know, here's one that's near and dear to my heart. You can see my Coke bottle glasses on my eyes, and apparently CoQ10 may be essential to preserving healthy visual function in adults. People with age-related macular degeneration, my arm is up if you can't see me, which is a common cause of vision loss, always have lower plasma of CoQ10 levels than do unaffected individuals. And this is all double-blind, placebo-controlled. Were you a part of the study that was this double-blind, placebo-controlled study talking about, I think it was a synergistic study of CoQ with acetyl L-carnitine and omega-3 fatty acids?
No, I wasn't part of it, but I'm aware of it. And just anecdotally, I've had a number of patients with early macular degenerative changes that we've put on Q 20 years ago, and they have not progressed at all. They're fine, which doesn't normally happen. Normally that's a progressive disease. So I think there's no question it's protective.
That is going to be something I'm going to be, just on this conversation alone, I'm going to be implementing more into my diet. Also, intriguing evidence suggesting that CoQ may even help improve male fertility, helping with low sperm count and impaired sperm motility as well.
Yeah, the sperm definitely swim faster with Q. You know, right around that tail, it's packed with mitochondria, and you can measure the speed that sperm swim. And if you supplement with Q, they swim a lot better, which has a lot to do with fertility, obviously. So, yeah, there's been some really nice studies. There's a lot of Italian work with the sperm motility that's kind of fun.
The Michael Phelps of Phelps enzyme
effect. Right.
Yeah, the Michael Phelps effect. Yeah, that would be better. Let's just do a couple more on CoQ, because there's so many things, and I want to sort of get to I want to try to get to everybody's different impairments. So forgive me for staying on CoQ so long, but you know, there's so many different applications. One of the applications, fighting skin and other cancers, photoaging, And here's one that's important to me because just in the last 3 or 4 years I've noticed this in myself. Blood sugar issues. I've really cut down on my to get rid of my for a long time, and I was starting to get blood sugar issues. So how does the CoQ help us? I know I gave you a bunch of different issues, but let's tackle blood sugar because that's a huge issue right now with the population is migrating towards a pre-diabetic state in droves. That can CoQ help us with that?
I think the dominant effect in the increase in diabetes is dietary. It's the consumption of large amounts of high fructose corn syrup and refined carbs. So the obesity epidemic correlates perfectly with the diabetic epidemic. CoQ10 helps some, and we're not really sure how. We looked at a group of about 100 diabetics, adult onset diabetics, and when we put them on CoQ10 for their heart disease, about a third of them were able to completely come off their diabetic medications, and so they definitely had improvement. About 2/3 stayed roughly the same, but we don't know if we're improving the bioenergetics that relates to the pancreatic, islet cells that make insulin, or whether we're influencing receptor chemistry where you improve sensitivity. I don't think anybody really knows that. We know that the converse, if you deplete Q on purpose with a statin, you increase diabetes significantly. And we don't know if it's because of the Q depletion or not, but it might be.
We are talking with Dr. Peter Langsjoen, considered one of the world's foremost experts in the use of CoQ10 to treat pretty much every disease out there, with an emphasis on cardiac disease. And really giving us some great information here, Dr. Langsjoen. One of the other categories that CoQ is supposed to help in, and I'll be talking with Ramiel Nagel, I hope I said his last name right, later on in the summer, about dental health. And he is a proponent of organ meats. You had mentioned organ meats earlier to increase the coenzyme Q10 blood plasma levels. He is a proponent of that for dental health. I'm having a feeling you guys might get along. He's really has some interesting literature and interesting studies that he's conducted. How does CoQ10 help with periodontal disease?
We assume a couple of things. The honest answer is we're not really sure, but the gums, especially when they're inflamed, they're rapidly dividing. And anything that divides rapidly is using a lot of energy and therefore is dependent on Q. It may have, anti-inflammatory or free radical scavenging effects that are beneficial. You have this terrible, angry, bloody mess, really. And if you have people take soft gels of Q and let them dissolve in their mouth, they get both a topical effect, and then, of course, you swallow it and you get a general internal effect as well. But it is clearly helpful. The exact mechanism is not been worked out, but it's probably a combination of the energy and defense.
One of the other indicators, and tell me if this is an indicator, but they did some studies in patients who are suffering from HIV infection, which obviously is an immune system. It's very implicated in immune weakened individuals, and these patients are vulnerable to ranges of infections due to their weakened immune system. Every one of these inflammatory diseases we're talking about, heart disease, periodontal disease, diabetes, HIV, when you study these patients, they all have very low blood plasma levels. of CoQ10. So can you safely deduct and sort of reverse engineer and say, you know, they all have low blood serum levels of it. If we increase those levels, then is that a safe? You know, it obviously, you know, I'm not even close to being a doctor, and so you know, I'm not sure what the protocol is here, but you know, are we at the point now where it's pretty irrefutable how important this is for all of these different inflammatory diseases?
Yeah, in AIDS, we actually studied that here in Tyler before the introduction of the AZT and then all the other AIDS drugs. And we found that Q levels in HIV patients with no symptoms were the same as healthy people. But the Q levels in people with full-blown AIDS were very, very low, some of the lowest we've ever seen. And we also knew in those early years that some AIDS patients were dying of dilated cardiomyopathy, which was, of course, our specialty. And so we were quite intrigued by it, and we studied CoQ10 in these very, very sick AIDS patients with these super low blood levels. And the improvements were striking. I mean, it was unbelievable. The problem that we had is as soon as they left the hospital, in our particular subset of patients, many were IV drug abusers. And so they went back to that lifestyle, stopped taking any CoQ10 supplements, and within a month or two were back in the hospital. So it was like a roller coaster. But I mean, it was clearly favorable when we had the ability to administer it on a regular schedule and check blood levels. It was very exciting, actually. But it's when you have a lifestyle that sort of thwarts that, it's pretty tough. You know,
compliance is always the big issue, isn't it? That
was kind of hard.
Yeah.
I probably should mention a little bit about dosage of Q.
Yes, that's my audience right now is they already, probably half of them already know this and they're already loving CoQ, but for the other half who now are all turned on to it, yeah, how do we get it? And I've seen it in the health food stores and it is expensive. But you were saying that there's a nutritional protocol that you could do, and is that even more effective because you have the cofactors?
You know, it is as effective for sure. And back when CoQ10 was exceedingly expensive, about 25 years ago, we treated cardiomyopathy patients with a very simple regimen. One day of the week, we'd have them get a pint, that's a lot, of chicken hearts, and make chili or stew or whatever they wanted to with it, and eat that once a week. And then on another day of the week, we'd have them eat some kind of liver, like either pate or fried chicken livers or, whatever kind of liver they wanted to. But so 2 out of 7 days we had them eat foods that we knew were very, very high in Q. And they did great. They had therapeutic blood levels. Their heart muscle did wonderful. They did as well as taking a whole handful of expensive, Q supplements. The other point to make is that supplemental Q used to be exceedingly simple. All the Q in the world was made by one of 3 companies, all in Japan. It was all good. It was all very high quality, pure CoQ10. That's no longer the case. Over the last, I'd say, 7 or 8 years, other countries, particularly China, makes over half of the world's Q with variable qualities. And so you have to be a little careful now where you get your Q and read the fine print. And the best Q for the money has changed over the years. At one particular time there was a company, they've since been bought out, but a company called Vitaline out of Oregon. They made a wonderful chewable tablet, very affordable, and if you chewed it up with a spoon of peanut butter, you got great blood levels. And that was our favorite Q for 10 years, maybe. Then there was a company out of New York, Tishcon, that made a Q that was like in an emulsion. That gave excellent blood levels, and that was the Q that we recommended for quite some time. Currently, and your audience will, I think, probably have already heard about this, but you can get two types of supplemental Q. The one that's been on the market for a long, long time is oxidized Q. That's bright orange powder when it's formed, and it's usually mixed with a variety of oils or as a dry tablet. About 6 years ago, one company, that's a Japanese company called Konica, and they have a big plant in Pasadena, Houston, that makes the reduced form of Q. That's a white crystalline powder. They're interchangeable once you swallow them, but the Ubiquinol product, and that's on the bottle, is about 2 times better absorbed, 2 to 3 times, which is a lot. And since it's only made, at least right now, by one company, it's been wonderfully consistent. We haven't seen any variability, from batch to batch, and we've consistently seen good blood levels with that Q. So, especially in people where you don't have a lot of freedom of time, if they're really sick and they may have a life expectancy that would be measured in months, not years, you need to use the best Q you can get your hands on. And right now we prefer this Ubiquinol product, and we see beautiful levels, and we like to get blood levels above 3.5. It's micrograms per milliliter. So we get them up around, let's say, 5 or 6. And at that level, you see your best response. And if it's lower than that, if you have a level of only, let's say, 2, they're not going to do very well. And so it's actually, this is a good thing. Major labs like Quest, major national labs, are beginning to offer CoQ10 blood levels. That's a relatively new development. It used to be difficult to get Q levels because they were only done by just a few research centers. But now that the commercial labs are doing them, you can check your Q level and see if it's see if it's above 3.5. Because everybody absorbs it a little differently, and so that's a change in the last few years that's been quite helpful for people who are trying to see if Q is going to help them in some way.
So it's called Ubiquinol, and I believe it's spelled Ubiquinol.
Yes.
Ubiquinol,
right.
And is that the actual name of CoEnzyme Q10, or is that a product name? Like if I was going into a GNC or a vitamin shop, I would actually ask for Ubiquinol?
Yeah, that's a molecular name. So it would have Ubiquinol somewhere in fine print. Then it would have the encapsulation company. It could be Now Products. It could be Jaro. It could be any number of Healthy Origins. There's a long list of companies that encapsulate Q. So that'd be the biggest name on the bottle. But somewhere on there it would say the chemical name, which is Ubiquinol. And often it'll also, in parentheses somewhere, have the manufacturer's name, and that's Konica. If it has those 2 words on it, Ubiquinol and Konica, they're all good. It doesn't matter who's encapsulating it.
So Konica, look for Konica. That's the Japanese origin, and that's been consistently performing for you.
Yeah, that currently is our favorite. Yeah.
Can you take too much Q?
No, you can't. It's been tried, and you just absolutely can't. If you take over about 200 to 300 milligrams in one dose, you're not going to absorb all that. So if you're in, let's say, some of these really sick patients, we give them 200 milligrams 3 times a day. If you gave them 600 all at once, you'd be wasting a lot of the Q. There's a saturation effect. We can absorb somewhere around 200 in one dose. That's about the maximum. But no, there's not any toxicity to any level.
What is the difference between ubiquinol and ubiquinone?
The only difference is in absorption. The immediate gut barrier. After it's absorbed, they're identical because they're interchangeable. So the only difference is absorption. That's it.
Well, we're running out of our time, Dr. Langsjoen, but I did want to get to one other quick topic. Well, it might be quick, might not be, but we'll try to keep it quick. A lot of people who are dealing with heart issues, including my dad and a lot of other people, have been prescribed statins by the traditional allopathic medical community. You've gone on record as saying that you don't think statins are indicated, I think, ever. Can you explain why statins are not indicated as a health protocol?
Yeah, 2 simple words. One is they're far too toxic. They cause a significant deterioration in your mental acuity, which can be permanent. The first thing that goes is your short-term memory. The brain cannot function with a decrease in cholesterol. It needs a lot. The second thing is fatigue. There's a general decrease in your ability, for instance, to exercise. Exercise does more for your heart than any drug will ever do. You get a variety of muscle and joint aches and pains. You get a weakening of your heart muscle. You get an increase in diabetes, and then also frequently permanent, you can develop a peripheral neuropathy where you can't feel your feet, or you have these burning, tingling paresthesias in your feet. So the toxicity is far greater than you would be led to believe by, of course, drug company ads. And then on the other side of the ledger is the benefits are negligible. They really are. I mean, if you're especially if you're talking about what really counts, that's mortality. There's no mortality benefit after the age of 65, and there's no mortality in women of any age. And yet, these drugs are prescribed with what I term reckless abandon. They're aggressively prescribed to the elderly, and it's devastating. I mean, you just rapidly are going to end up in a nursing home because nothing works.
One other quick thing to address, and first, before we address that, thank you. It'd be very easy for you, with your credibility and with the prestige that you carry, to hop onto the big pharma synthetic bandwagon and make a lot of money. And but you're out there speaking truth to power and telling people how to get real health. So I want to congratulate and thank you for that. Not easy, man, because big pharma's got the big money, and they love to get big chiefs like you, big thought leaders like you, because you can sell a lot of product. So thanks for the integrity.
You bet. That's where the real joy in life is, anyway.
I agree. One other thing to quickly touch upon, because a lot of people who listen to the show are vegans and vegetarians, and I was a vegan for a long time. The entire time I lived in Los Angeles, so almost a decade of being a vegan. And the reason I did come over to more of a paleo approach, and I don't even have to call it paleo, call it what you want. I want to eat a little more grass-fed meat. It helps me to flatten out my stomach, and it helps me to think more clearly. I just couldn't lose the 15 pounds that I needed to lose without doing it. So it worked for me. And you were talking about how much cholesterol the brain needs. Cholesterol's got a bad rap. The brain needs it, and the brain needs these oils. Can you just speak quickly to that? We are running out of time, but just to my vegan and vegetarian friends who might be contemplating a little fish oil in their diet, or maybe some salmon or some mackerel, would you encourage them to do that?
Oh, I think so. I mean, omega-3 is essential for life, so you should get it. If they didn't want to eat fish, you could get it with ground flax. That's a source of omega-3. But the other thing they should consider is taking Q, even if they're in good health, because Q has a wonderful protective effect on these aging phenomenon that occurs in our mitochondria. And vegetarians, they tend to be relatively healthy people. They're health conscious, but they can certainly get low in Q. Now, they can make their own Q, but again, it goes down with age. And so
can you get Q through vegetarian sources? I mean, you had mentioned all of the organ meats.
All the Q in the world just about is extracted from a yeast. Now, that's neither a plant nor an animal. That's in the fungal kingdom. So I don't know how they feel about that. But there are strains of yeast that make huge amounts of CoQ10, and that's where most Q is whatever manufactured by. So it's a yeast product.
But with the ability to get, you were saying, to eat organ meats, hearts and livers to get high levels of Q, if they don't want to spend a lot of money at Vitamin Shop and GNC buying the supplements, is there a food product in the vegetarian world that would have as high a level Q or that has Q at all?
No. Remember, Q is essential for energy. The animals that have the highest Q are the most active. Hummingbirds, with a resting heart rate of 1,000, have the highest Q concentration in the world in their heart. A snapping turtle is dramatically lower. They're very, very slow. Plants have Q, but they're even slower yet. They do move, they grow, and they have mitochondria, but only sparsely. And so there is CoQ10 in virtually all plants, but in tiny, tiny amounts compared to, high energy using creatures like animals. So I think for the vegetarians, their best bet would be to supplement, realizing they're taking, it's identical to your own CoQ10. There's no difference in the structure, and it's extracted from a yeast. So I would think that would be acceptable.
Are there any counterindications? For people who have candidiasis? Because that is a yeast issue. I know I'm kind of going on here in left field here, but
no.
Okay.
It's a good question, but no, because this is crystallized pure Q. There's nothing else in it. It's amazingly, So as far as yeast antigens or capsules or parts of the cell wall, they're not there. That's a good question, but it's too refined, I think, for that to be an issue.
Yeah. Well, we are just plumb out of time. Just an amazing, fascinating discussion. Was there anything else? We've got about 45 seconds left. Anything else you wanted to give a quick touch upon or say to the people out here who are listening?
I just appreciate the opportunity to visit with you. It's been a pleasure.
Thank you for all of the great work you're doing, Dr. Langsjoen. You're really helping a lot of people. And if people want to get in touch with you or find out more about your organization, where would they go?
That's a good question. Our website's sort of a disaster, but they can send emails. We answer them the best we can. Like we sort of get swamped there. Which one? drlangsjoen.com. Yeah, they could go to drlangsjoen.com. It has all of my publications and all the abstracts are there. At any rate, that's something like that might be helpful.
That's great. Now, you're also on the board of directors for Life Extension Foundation. So could they get a hold of you or find out more about your work through that organization?
They might be able to. I've never tried, but yeah, that's possible.
Yeah. Well, certainly if they're in Tyler, Texas, they ought to stop off and say hi.
Oh, sure. That's the easiest. Yeah.
Well, thank you very much, and we appreciate it, and to your lovely wife, Allie, for helping us as well. Thanks for joining us, Doctor, and for all the good work you're doing out there.
You bet. Thank you.
I'm Jay Adams. Thanks for joining us in our quest to live life clear-headed and shredded. We'll see you next time.
For our full schedule of fights on the NBC Sports Network, CW and ABC affiliates, visit UnitedFightAlliance.com. United Fight Alliance. United, we fight.